Rolling forward, doctor, sister, science, facts.
I ended our prior episode by saying we were going to do some positive health news, so I should start with positive health news. But it's not been a good week for health news, and that was not my fault. Find me some positive health news.
I'm asking ChatGPT. It said conversation not found, error. Please try starting a new conversation.
Welcome to this week's episode of the Rolling Forward podcast, where we're bringing our health news updates, and they've been concerning.
I'm Dr. Alicia Rowland.
I'm Dr. Stephanie Rowland.
We're both physician researchers. We practice part-time clinically, mostly in emergency departments, and part-time we do research.
And this week we're going to be talking to you about the Advisory Committee on Immunization Practices, or ACIP. We're going to tell you about what this committee is, why they're in the news right now, why this matters, and what we can expect moving forward.
Rolling forward, doctor, sister, science, facts.
This is not the first time that we discuss ACIP. I think we discussed it briefly in one of the measles episodes. I think measles 201.
So you can always go back and listen to Measles 101 and Measles 201 if you haven't heard those yet, because the measles outbreak is still happening. We are up to... I mean, I'm making like positive sound.
I was going to be like, it should be the Darth Vader, like, entering the room music.
Give me the Darth Vader music.
Dum, 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 da dum, 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 dum.
We are up to nearly 1,200 cases of measles this year, with about 30% of those happening in children under 5 and 95% happening in people that are unvaccinated. About 12% of people who have had measles have needed to be hospitalized for it, and there have been 3 deaths. So this outbreak is growing. It's spreading, and we talked about the Advisory Committee on Immunization Practices briefly in that episode, because the ACIP is a group of medical and public health experts that advise the CDC on vaccines and immunization schedules.
This is a long-standing organization. It was established in the 1960s, and it traditionally has about 15 voting members, and then they invite some non-voting members to their meetings. And the role of the ACIP is to meet on a regular basis and review scientific data that comes out on vaccine efficacy, safety, and cost effectiveness. And they provide recommendations to the CDC on what vaccine schedule should be used for children, adults, and adolescents. And essentially, they issue guidance that will influence national immunization policies.
So the ACIP is making these official recommendations to the CDC on the timing, dose, and safety of vaccines, which then influences insurance coverage and public health programs that offer vaccines.
So if a new pancreatic cancer vaccine is developed and becomes available, the ACIP will review the evidence and make recommendations about who should get it, when, and how often.
We've long relied on the ACIP to help guide vaccinations in America, which is why it was so concerning when earlier this week, HHS Secretary Robert F. Kennedy Jr. removed all of its members at once. All of them.
Goodbye. You are the weakest link. Goodbye.
They all were. And so he removed all of them and has now named 8 new appointees.
He has said that, quote, a clean sweep is necessary to reestablish public confidence in vaccine science. The committee will no longer function as a rubber stamp for industry profit-taking agendas.
There was some information put out about this from HHS that said, today we are prioritizing the restoration of public trust above any specific pro or anti-vaccine agenda. When Robert F. Kennedy Jr. is talking about not wanting to be pro or anti-vaccine, it just reminds me of that moment in his confirmation hearings when he was talking about taking sides on 9/11.
I'm sorry.
Because, like, there are no sides to take on 9/11. What sides are you possibly taking? Which is what Senator
It was Tim Kaine.
Which is what Senator Kaine called him out for. Like, what are these sides that you're seeing on 9/11? And I have to be clear that there are not these sides on vaccines as well. The evidence supporting vaccines is extremely clear. When you think about prior diseases like smallpox and polio, these are diseases that caused widespread death and paralysis, but are now almost eradicated due to widespread vaccination efforts.
Smallpox was officially eradicated globally in the 1980s. Polio was very, very close to being eradicated, but it's rare to meet nowadays someone that has polio or has had polio in the past. One notable person who had polio, Senator Mitch McConnell, the only Republican to vote nay on RFK Jr.
Because this is a man who's experienced polio and hopefully understands the importance of the polio vaccine. And so there's not this both sides on vaccines. Vaccines save lives. Vaccines cause adults. Vaccines are helpful. That doesn't mean that we can't look at vaccines individually and try to evaluate risks and benefits, cost-effective analysis, and so forth.
The science on vaccines is so clear that in 2024, The Lancet, one of the journals on RFK Jr.'s hit list, published an article that vaccines have saved an estimated 154 million lives globally since 1974, with about 95% of those lives saved being children younger than 5 years old. This is huge. Vaccines are effective. Vaccines are saving children's lives.
I don't see how we're going to restore public trust by removing people who believe in science from this committee. He doesn't want ACIP to have a pro or anti-vaccine agenda. I mean, their role is to recommend vaccines. Vaccines save lives. Wouldn't you expect it to be pro-vaccine?
I mean, honestly, I can't understand why a single person is not pro-vaccine.
I don't get it at all.
I don't understand the controversy. Vaccines are effective. Vaccines save lives. Vaccines are the reason that you and I haven't experienced polio, smallpox, diphtheria, that we haven't had tetanus,
mumps, rubella, all these other things. And this move from RFK Jr. did get a lot of public health pushback.
There's been a lot of media coverage of physicians, of public health experts calling out an alarm, criticizing this decision to not only wipe out the existing ACIP, but of these new 8 members.
There have been 8 new members so far named by RFK Jr. to the ACIP. Overall, this is a group of people that are mostly older. They're all white and majority men. This is in contrast to the past 10 years when we had a panel of ACIP members that were about a third to a half women, with more members of racial and ethnic minority backgrounds.
There are people from emergency medicine, a psychiatrist, nutrition, women's health, which I think sounds nice, but they actually really lack virology, immunology, vaccine-specific expertise. These are not experts in the field of vaccinations.
It's great that there's this broader representation of medicine, but also this is a panel that's specifically convened to review vaccines. And so it is kind of surprising that there's so few people on this panel that are actually experts in this particular field.
I don't particularly want my cardiologist to be dictating my chemo regimen. I don't want my oncologist to be performing my cardiac surgery. Medicine is really complex. People are highly specialized because it takes that many years of training to be an expert on that one little thing. Physicians are not experts in all of medicine. It's just not feasible.
Makes sense to me. And yet here we are, despite the public health pushback, despite the concern, things are moving forward and we have these new members.
So let's meet the candidates.
First up is Dr. Robert Malone.
If there's one person you've heard on this committee, it's likely Dr. Robert Malone.
Doctor, which, yes, it's great that someone has that level of expertise, but this is probably not why you've heard of him.
You probably heard of him after a very infamous 2021 episode of the Joe Rogan podcast.
Oh, no. Oh.
He went on this podcast to claim that, quote, mass formation psychosis was developing in America as a reaction to the COVID-19 pandemic, and made a lot of comparisons between the U.S. during COVID-19 and the rise of Nazi Germany. He reported that parts of the population had been, quote, hypnotized by health professionals into believing the recommendations given on COVID-19.
And there was pushback from the medical community with 270 physicians, scientists, academics, nurses, students writing an open letter to Spotify saying, hey, this episode of the podcast is concerning. And what is this man talking about?
I feel like Joe Rogan at baseline is concerning. So to have this many people reach out and be like, this episode is particularly bad and is spreading misinformation, disinformation is noteworthy. Our next member, is Dr. Martin Kulldorff. He is a Swedish epidemiologist and very famously was a Harvard professor, but was fired in 2024 after refusing to get his COVID-19 vaccine.
That's right. So he is part of the Great Barrington Declaration. This letter was written by 3 scientists, Dr. Jay Bhattacharya, whose name might be familiar because he's currently the head of the NIH, Dr. Sunitra Gupta, and then Dr. Martin Kulldorff. And they wrote this letter in October of 2020, arguing that COVID-19 policies like lockdowns were causing more harm than any good, especially to poor people and to children, and argued for these focused restrictions instead of broad restrictions where essentially high-risk groups like the elderly should just protect themselves as opposed to everyone trying to reduce spread, and to allow those that were at lower risk, those that were young and healthy, to live normal lives, while other people who were at risk just needed to be the ones to observe certain restrictions. Overall, this was really rejected by major health organizations like the WHO and the CDC, saying that this letter was really underestimating COVID-19 risks for younger adults, and it was totally ignoring the issue of long COVID that was becoming more apparent, and that it was impractical to just expect those at risk to protect themselves and the rest of society to continue as normal. For people who really hated these lockdowns, the 3 authors of this letter have gone on to a lot of renown and fame, one now heading the NIH, and now Dr. Martin Kulldorff serving on ACIP.
This idea that it's your responsibility to protect yourself if you're at risk and I shouldn't have to care about you reminds me a lot of RFK Jr.'s view that society shouldn't be responsible for your bad choices and that people should be penalized and punished for their own health making decisions. And that if you smoke cigarettes, your health insurance shouldn't cover lung cancer, which is what he said during his confirmation hearing. I'm seeing a lot of parallels here.
It's sort of the libertarian viewpoint of health, but that's not how public health works. Public health relies on the health of a community and that we're all interconnected. We can't have a libertarian approach to it, but that seems to be what he's arguing for.
So far, I'm seeing a lot of anti-vaccine members on this group that RFK Jr. himself said he wasn't looking for a pro or anti-vaccine agenda. It seems to me like there's a very strong anti-vaccine agenda.
So the next member of the ACIP is Dr. Retsef Levy, who's a professor at MIT who specializes in operations research and supply chains. This sounds very technical, very impressive, but not really that related to virology or immunology as far as I can tell.
He has been a vocal critic of certain vaccines and vaccine safety and has even tweeted that certain vaccines can cause serious harms, including death, specifically around young people. So again, we're not looking for a pro or anti-vaccine agenda, but it looks like we're looking for an anti-vaccine agenda.
It seems like we might have found an anti-vaccine agenda, despite the fact that we weren't looking for it. The next member of the committee is Dr. Cody Meissner, a pediatrician who actually has been on the ACIP in the past. He served from 2008 to 2012, and he was also a voting member of the FDA's Vaccine and Related Biological Products Advisory Committee when the COVID-19 boosters were being rolled out. So this is a man who does have some relevant experience. So clap, clap, clap.
Good job. We found a member that might actually be qualified for this committee. Amazing job. We're at what, 1 of 4?
1 so far.
He has in the past praised vaccine. He called the COVID-19 vaccine extraordinary. He acknowledged that they saved millions of lives, while in the same sentence arguing for more selective use in low-risk groups. So might be qualified, might not have exactly the same views as me, but I'll take him over some other people. I'm still not the most thrilled.
Yeah, so he has this experience. He does praise vaccines, but he has really supported HHS's decision to stop recommending COVID-19 vaccines for healthy children and pregnant women, despite, again, scientific concerns that these vaccines are in fact helpful, but he supports pulling them back while also supporting vaccines. So maybe this is the first person who's not pro or anti and has more nuanced views, but he certainly has views. This isn't a person coming with like no views.
Ooh, the next member, I'm definitely not going to know how to say this last name. Dr. Joseph Hibbelin?
Yeah. Psychiatrist. Nutritional neuroscientist. Not a term I've heard before.
He's someone that has very little vaccine experience and is definitely not an infectious disease doctor. He's not a virologist. He is not a vaccine expert. He is an expert on mental health, which is great and super important, but I'm not sure that's the person I want deciding whether or not I get a meningitis vaccine.
As a fellow psychiatrist, mental health is so important, and I do think that psychiatry and mental health should be a part of every conversation, but I'm not sure that it should be a part of this conversation. When we're thinking about reviewing the safety and efficacy data around vaccines, I feel like someone who's got expertise in infectious diseases, virology, and immunology is going to be a really important voice in the room. So, psychiatrist, physician, former NIH committee, he did lead studies looking at omega-3 fatty acids and its impact on mental health. So you can see his alignment with RFK Jr.'s agenda about wellness and lifestyle medicine. But his vaccine experience is
little to none
as far as his public profile is available. So again, his role on this, I'm not sure what to take away from it.
Next up, an emergency medicine physician, Dr. James Pagano. RFK Jr. has said that they added him to the committee to be a, quote, strong advocate for evidence-based medicine. I love evidence-based medicine. I love strong proponents of evidence-based medicine, except that as far as we can tell, as far as news sources can tell, James Pagano has very little expertise in vaccine or infectious diseases, which is a theme that we're seeing running across this committee. He's known for being a very clinically heavy physician, serving as medical director in some major trauma centers and some community hospitals. So doing a lot of clinical work, not doing a lot of work on vaccines.
And it's great to have a clinical voice in the room, especially if they're in a conversation with a group of other people who have very strong immunology, virology expertise. But so far, that's not what the group appears to be to me. So amazing to have a clinician in the room speaking with experts, but it's just, are the experts there? We're not quite sure. Which brings us to our next member, Dr. Michael Ross.
He is an OBGYN, and this is our second of the 8 members that has been on the ACIP before. So he served from 2008 to 2012.
And he has been on a number of boards for private healthcare, life science firms, health groups. He served on all these different boards and positions, which, when we're talking about conflict of interest, that does seem to come up here somewhat. And he overall does support RFK Jr.'s call for placebo-controlled clinical trials of vaccines.
Ugh.
We're going to get more into that. But before we do that, let us introduce our 8th and final starring player.
8th and final player, Dr. Vicki Pebsworth. She's a nurse with lots of experience. She has a PhD in public health. She is a health policy analyst. She's a research scientist. But she's probably most known for 2 of her current roles. She serves as a regional director for the National Association of Catholic Nurses, and she is a board member and the director of research and patient safety at the National Vaccine Information Center. Now that sounds nice. National Vaccine Information Center. That sounds like a lovely place. It is one of the largest anti-vaccine groups in the United States.
And it was founded in the early 2000s, right around the time that this vaccine autism hoax started to circulate. And if you're curious about that, you can listen to our prior episode on the vaccine autism hoax. But tragically, Dr. Pebsworth feels that her son experienced long-term health issues following his 15-month vaccination visit. This was around the same time that these rumors about the vaccine autism hoax were really circulating. And so she's hearing this in the news that vaccines harm kids. Again, this was a hoax based on completely falsified data that has entirely been retracted. But at the time, we did not know that. And then she feels that her son experiences these consequences following vaccinations, and that really propels her to dedicate her career to doing vaccine safety or anti-vaccination work.
And she has been a very vocal advocate for vaccine removals. She's been very motivated, and she's been very heavily involved in public policy efforts, including through being on committees in the FDA. She has written a number of papers. She has made a lot of very vocal statements about mandatory vaccinations being unethical and unlawful.
And it seems like she's really using her anecdotal evidence, her lived experience, in order to inform her policy views rather than the larger scientific data. And so, although it's always wonderful to have people with lived experience contribute to the discussion, she's another member who is coming in with preformed views around vaccine safety, when the whole point of this change, according to HHS and RFK Jr., was to eliminate pro or anti-vaccine agenda. The deck really right now seems stacked against vaccines, with a lot of people who have preformed opinions about vaccine safety and efficacy based on their own personal beliefs, their own personal experiences, rather than the science.
RFK Jr. wanted this committee to be more independent and free from conflicts of interest. So far, this is the new committee. These are the 8 first members.
And what comes next is a meeting of this committee. The first ACIP meeting is scheduled to start June 25th, so later this month. And this is really going to be the first opportunity to see what this new panel of people decide to do.
And this can have a huge impact on families. They could recommend changes to the vaccine schedule, which could alter routine childhood and adult vaccinations. It could change access and cost of these vaccines. So if the ACIP is no longer recommending certain vaccines to the CDC and the CDC drops them from their schedule, your insurance company might decide not to pay for it anymore if it's no longer recommended by the CDC.
And it might be really hard to find. That's been the experience I'm hearing from my friends with kids who are younger than 1, that they're willing to pay out of pocket for a COVID-19 vaccine, and they can't find it anymore. No pediatrician's office is stocking it in their region because of these changes in policies. So this is not a committee that is just meeting and making a decision that's going to have no impact. We're already seeing very real impact from this administration's decisions around vaccines, and we're likely to see more, because what we're expecting during this ACIP meeting is, are they going to revise these COVID-19 guidelines further? What are they going to say about flu shots? Normally we get a flu shot every fall. Is that what's going to happen now? How about the RSV policies and what we can expect for protection for pregnant women and young children around RSV? And is this going to be, are these recommendations going to be driven by the data or by personal agendas?
Some of the things that has come up with many of these new members has been wanting new data, wanting specific data, following RFK Jr.'s rhetoric of needing better science about vaccines. And so something I'm curious about is whether or not they're going to recommend placebo trials.
Oof. So let's take a moment to talk about placebo trials. A placebo randomized controlled trial of a vaccine would be where we've got a big group of research participants and they're randomized. A group of them get the actual vaccine. The other group get a placebo, usually like a saline injection or something like that. And then the groups, they don't know what they got. They just know that they got something. It could be the real vaccine. It could be a placebo. And then they get followed over time. And researchers compare outcomes like how often do people get sick? What are the side effects? What does their immune system do?
So essentially, half the people get the vaccine, half the people don't. They get a fake water shot. And then we watch and see what happens.
This is a gold standard for testing new drugs, new vaccines, things that have never before been approved. But once we know a vaccine works, repeating a placebo-controlled trial is considered unethical because you would knowingly be leaving that placebo group unprotected from a serious disease when protection exists. And so typically what's done is that you compare a new vaccine against an existing licensed vaccine that you know works. So this is like an active control because you wouldn't just use nothing when you have something.
I can't imagine being like, let's create this new trial in the middle of a measles outbreak. This group of 1,000 people, no measles vaccine for you. This group of 1,000 people, measles vaccine for you. Let's see what happens. We know what happens. We've already done that study.
Because once a vaccine's proven to work, withholding it just to test a placebo is unethical. It violates this principle of equipoise because you can't run a randomized control trial if you know that one option is superior. And this administration is acting like they've never heard of equipoise. Instead, you compare it to an active control and then you follow people because large post-approval surveillance that happens is going to pick up rare side effects in a more ethical way. And I think the best place that you can see this disconnect is around the COVID-19 vaccine. When COVID-19 was a new illness, they did placebo-controlled trials of the COVID-19 vaccine. And I'm going to repeat that statement because you might not know this from listening to this administration, but placebo-controlled trials of the COVID-19 vaccine have been done with over 100,000 participants who were randomized to either get the COVID-19 vaccine or to receive a placebo, and they tracked efficacy and safety. And it was very clear that there were higher rates of COVID in the placebo group. This was known, and this is what fast-tracked the vaccines towards approval. And yet, that's not enough for these anti-vaccine agendas. They're still asking for placebo-controlled trials. Placebo-controlled trials were done. So I don't believe that placebo-controlled trials is what they actually want. They're not going to believe the data when it's there. They're only going to believe data that supports their pre-existing views. So we have these new ACIP members that are going to be reopening the question of should new versions of COVID-19 vaccines go back to these placebo-controlled trials, even though we already had placebo-controlled trials of our existing ones. And it's just totally unnecessary. It's putting people at risk of more illness. And we're going to see this come up, I believe, during this June meeting of the ACIP.
It's a 2-day meeting.
3-day.
3-day. I cannot count.
I mean,
it's a 3-day meeting and we're going to see what comes out, but I am not optimistic about the recommendations and what comes out of this meeting. I'm not optimistic. I am, as a pediatrician, frankly worried about the future of immunizations. And in our practice, like at work, we're talking more about how to recognize diseases that we haven't seen in generations.
Something we've said before and something that we'll repeat again, but to talk to your own personal doctor to see what vaccines you and your family might be due for and if there's any possibility of getting them now, early.
Before June 25th to 27th, if you're at the place where you're like just about due for a vaccine, your child's going to get them in a month or 2, 6 months, and you're interested in making sure that your child is fully vaccinated, this might be the time to reach out and say, hey, can we schedule an appointment in the next 10 days?
And talk to your doctor about it. It's something that I did with my daughter, who is almost 2.5. I reached out to our pediatrician, had a conversation with them about our personal risks and benefits, and decided to move forward with giving some vaccines early because I want to keep her safe and healthy and I want to keep her protected. And I'm worried about what's happening with vaccine access in this country. And now the good health news. Can we end with that? Do we have fun facts?
Vaccine fun facts.
Okay. Let's try to end with some vaccine and fun facts.
Oh.
Ooh.
Okay. Fun fact number 1. What is the root of the word vaccine?
I don't know. Is it Latin?
Mm-hmm.
Okay. And is it Latin for protection?
It's Latin for one of Marvel's favorite words.
Wow.
Vaca.
Vaca. Oh, right. From the original smallpox vaccines that came from cows, right?
Yeah, the first vaccine came from cowpox that was used to immunize for smallpox. And so the word vaccine comes from the root word vaka, which means cow.
Cow is one of my daughter's favorite words. Another one is wow. And when you ask her to do something like, oh, can you share? She goes, no, that's okay. No, that's okay, Mama. No, that's okay. So those are my three guesses. No, that's okay. Wow, and Vaca. So Vaca makes more sense for a vaccine.
Fun fact number 2.
Okay, fun fact number 2.
How was the first smallpox vaccines delivered?
They were based on cowpox, and you would drink the infected milk.
So they delivered the first vaccine across rough terrain on horseback via, quote, vaccine riders. There was a bunch of cowboys called vaccine riders in the early 1800s that were like riding around with vaccines.
Cue Netflix, because I would watch that show.
And it was the first kind of public health campaign, and they used glass quills filled with cowpox lymph to vaccinate people.
That sounds amazing.
I think, tacking on that, this is what I thought. I think what's really important in this kind of time period in this rhetoric, that smallpox is the only human disease to ever be completely eradicated, and that's fully due to vaccinations. And since it's been declared eradicated in 1980, we no longer get smallpox vaccinations. So we're not vaccinating forever against things that we don't need anymore. Like the CDC, ACIP, and the CDC have removed smallpox vaccinations from our guidelines.
And if we could just move forward with measles and and just keep eradicating them, then there would be less vaccines.
Let's see. Oh, okay. This is fun fact number 3 about vaccines. Which of the following is sometimes used to test the heat stability of certain vaccines that are temperature sensitive? A, hair dryers. You blow the hair dryer on it and you see how well it does. B, pizza ovens. You put it in the pizza oven, you make a pizza, and then you test the vaccine at the end. Or C, solar panels. You put it on the top, you let it roast in the sun, and you see what happens.
Hair dryer. I'm going hair dryer.
Eh.
Which one is it?
Pizza ovens.
Really?
Yeah.
You're using pizza ovens to test vaccines? Even more reasons to eat pizza tonight.
The oral cholera vaccine is heat sensitive, and it's often tested for stability in pizza ovens. Scientists use pizza ovens to mimic extreme heat environments to ensure that vaccines survive in hot rural regions without refrigeration.
Well, I think that means we need to have pizza tonight.
That sounds like a great idea. Support pizza ovens, support oral cholera vaccines, which is a very effective vaccine for a disease that is not as common in the United States and is not on the ACIP guidelines for the CDC. So they are not a touting pro-vaccine agenda. If it's not relevant to the country that you live in, they don't recommend it.
We were doing these positive health like quiz, and then you just took us.
Don't worry, I can make everyone into a negative. Challenge accepted.
Rolling forward, Dr. Sister Science Facts.
So thank you for joining us this week as we talked about the ACIP. Maybe a committee you hadn't heard of before just a few weeks ago, but one that is certainly going to have a big impact on all of our lives moving forward.
I'm Dr. Alicia Rowland.
I'm Dr. Stephanie Rowland.
You can reach out, like, subscribe on all the social media platforms, or send us an email at RolandForwardShow. That's ROLIN @gmail.com.
Thank you for tuning in.
Until next time.
Rolling forward, Dr. Sister Science Facts.
Oh, fireworks.
Oh, fireworks. You know what they are.
Oh, fireworks.
You know exactly what those fireworks are.
I don't know how to say this nicely.
What do you want to say unnicely?